Okay. So these are a few of the pictures from Glasgow. So this presentation is incomplete without mentioning my study buddy, Dr. Asif Virani, and this would be the first tip for any aspirant of this examination is to have somebody you can bounce off your preparation with. And the two of us, after successfully completing the examination, went and attended this beautiful ceremony, the convocation ceremony, with a lot of pomp and pageantry. So it's something you can treat yourself to after giving this arduous exam. In brief, the examination is divided into 3 parts. The first part essentially tests you on basic sciences, which is optics and refraction, as well as clinical, clinical ophthalmology. They're all MCQ examinations, MCQ tests. The second part is on clinical sciences, which are again an MCQ test. आप आगे बढ़ा रहे हैं? हाँ. And the third part, so the MCQ, so the second part used to have a problem-solving component, which was a written examination where you had essay kind of questions. That has since recently been discontinued, and now this is also in the form of an MCQ examination. The third part is the actual practical examination, as we may wish to call it. It is an OSCE component called a structured oral examination, which has 3 stations, and the clinical examination in which you see patients and examine patients in front of the examiner. These are conducted on 2 different days, so you have a day's gap in between generally, and it becomes a 3-day event. Who's eligible to give these examinations? For part 1, you need a primary qualification that is acceptable to the GMC UK, which essentially means an MBBS degree from India is fine, but you need minimum 2 years post-qualification experience, to which your 1 year of internship counts. So you don't need any special ophthalmic training to appear for part 1. For part 2, however, you require 6 years of post-qualification training, which also once again includes your 1 year internship. And 4.5 years of these 6 years should be in clinical ophthalmology. So if you may have done a post, or if you may have clinical experience in a non-ophthalmic field, that can still count towards these 6 years. But 4.5 years, sorry, that's not months, that should be years. 4.5 years should be in clinical ophthalmology. So it is not so easy probably during your residency to give this. You may have to wait post-residency, post-fellowship to give part 2. And part 3 essentially requires you to have completed parts 1 and 2. These are the fees as of December, and they go up every year by almost 10%. So the sooner you start on this course, probably the cheaper it is, because there was, with Brexit, a little bit of devaluation of the pound, which made it a little easier. But as of 2 days ago, it's 104 rupees to a pound, so it becomes fairly expensive to give these examinations. Now you have 6 attempts for each part. These are data taken off from the website, so you can always go to the website and check these. But 6 attempts is really a long time, because by that stage, for each part, 18 attempts, either you will be financially drained or physically and emotionally drained. So I'm sure nobody will require these many parts. It's not such a difficult examination as one may think. And now, recently, they have started offering the MRCS degree. So after completion of 2 parts, you may apply to them for the MRCS degree. And that, of course, requires a separate subscription fee that you need to pay for. These are certain exemptions. So if you've done part A, for example, of the Royal College of Surgeons of Edinburgh examination, or you've done the RCO examination, then you have cross exemption with the FRCS Glasgow examination. The rest of them are a little, and the ICO the ICO examinations also used to have some cross exemption with the FRCS Glasgow. The rest of them are national examinations. So unfortunately, neither the DNB examinations of India nor the MS examinations offer you any value as a cross exemption for the FRCS. This is the website, so I strongly recommend anybody who's taking this journey to first go through all these details on the website and make sure that you're familiar with all the rules and the exclusions before you set out. A little bit about the examination itself. These examinations are not as the ones that we are used to, where there is in India, there is generally a cutoff mark, whether it's 35% or 50%, which means you need to score 50% correct out of all the 100 questions, then you pass the examination. It's not like this over here. Here there is a pass mark that is based upon the difficulty level of the examination, which means that all the examiners or the paper setters will sit and they will set a paper which will comprise of some easy questions and some difficult questions. If there is a majority of difficult questions, the pass mark gets lowered, and if it's a majority of easy questions, the pass mark gets raised. So the pass mark is dynamic and it depends on that exact paper. You won't know the pass mark before you appear for the examination. So here, for example, the pass mark was an extremely odd 62.21%. And if you score 62.21% or more, that's when you pass the exam. A little bit about how to prepare for the examinations. Part 1, which as I mentioned, is optics and basic sciences. I strongly recommend these textbooks, Elkington, as well as Dr. A.K. Khurana's excellent textbook on clinical optics. It can be a little large or voluminous to go through, but it gives you a good foundation, and I would therefore recommend passing or clearing part 1, both optics and clinical and the basic sciences, within the first year of your MS or DNB, because that's when you're freshest and you can really spend time and devote time to this. John Ferris, of course, this preeminent textbook of MCQs is excellent preparation both for the ICO examination part 1 as well as the part 1 FRCS. Part 2, which is clinical ophthalmology. Again, being an MCQ based examination, I would strongly recommend this book, which is what I used, the Mass Eye and Ear Infirmary Review Manual, originally authored by Jeffrey Lampkin and subsequently by numerous other editors. And it has fairly difficult MCQs to answer, but they give you the explanation for each right and each wrong answer, so it's very helpful in that regard. There are questions on emergency medicine, so you need to be familiar with these emergency situations and their management. Once again, these are the sort of syllabus that is taken from the website of the FRCS exam, for FRCS, the RCS college itself. So you can see these, and you need to be familiar with not only the conditions, their diagnosis, but also their first aid management and their treatment, including dosages. So you would need to know all of this as well. A few tips. In the theory examination also, they are very practical oriented questions. You are not going to be asked percentages of or incidence of a particular disease, but you may be given clinical scenarios even in the clinical, in the MCQ test, and you need to come to a diagnosis and come to a proper management. And in general, all your answers would proceed from a life-threatening condition to something that is then vision-threatening to something that would be only of cosmetic importance. So even when you're answering your Viva questions or your clinical examination questions, you need to be prioritizing your answer in this manner. Coming to the part 3, which really is the meat of the examination, as I mentioned, there's a OSCE station, which is called a structured oral examination, but it's really a whirlwind examination because you are put in front of 2 examiners and they show you different spots or slides, and there's very little time for you to really try to understand what they're trying to show you. But the good news is that the questions that they'll ask you are very structured. They won't ask you anything off the top of their hat. They would have questions that they are supposed to be asking you for that particular spot. So it's a very fair examination. It's a very structured examination. It's not arbitrary or based on the whims and fancies of the examiner, but it is exhaustive in the sense that you need to pay attention to certain topics that you would otherwise have ignored for your MS or DNB, including a lot of oculoplasty and neuro-ophthalmology. You cannot ignore these subjects because you need to independently pass these stations to clear the examination. So lids, oculoplasty and anterior segment are examined together. Posterior segment, including glaucoma, is examined together. And there's a separate station on neurology, motility and general medicine. Now, once again, in this station, most of the questions are ophthalmology oriented. So you may have questions on neovascular glaucoma or multiple sclerosis or rheumatoid arthritis, conditions which have ophthalmic importance. They won't ask you very esoteric neurological disorders, but you must know, have that breadth of knowledge to be able to answer it. So as I mentioned, it's in the form of a picture or a clinical situation. You may be given a report of a visual field examination or an OCT, And generally, you will be asked more than one question per spot, so you need to answer each question correctly to go on to the next sub-part. The clinical stations are 4 in number. There's an anterior segment, posterior segment, and glaucoma, neuro-ophthalmic and ocular motility disorders, and the last is oculoplasty and lid disorders. So you have only 12 minutes at each station. Once again, there's a team of 2 examiners at each station, and generally you have, you may be able to see 3 or 4 patients per station. The rule of thumb is that the more patients you see, the better you're doing, because it means that the examiner is satisfied with your answers and then asks you to examine the next patient. But don't be discouraged. You may spend a lot of time on one patient simply because the examiner is wanting to get to the depth of your knowledge in that. But once again, the questions are very structured and you won't be asked anything very extraordinary for that clinical topic. A very important point is that you have to practice these answers. It's not easy to jump from your DNB MS examination to the FRCS examination. I'm not calling it a jump in terms of it being a better or more valuable examination, but it's simply that it's totally different. So you need to orient yourself in that manner. You need to practice fluency of speech, practice fluency of a presence of mind, thinking as to what exactly is being asked for, and focusing your answer in as short a time as possible to fit in and get in all the key words and the key points. A few advantages of doing the FRCS examination is that you don't need to then give the PLAB. If you wish to move to the UK, you can directly register with the GMC. Of course, I think most of us give these examinations for brand recognition or their brand value. There may be a potential for better remuneration in the Middle East, though of course the rules are changing, and now it is, in most cases, you require clinical experience in the UK before you can avail of higher paying jobs in the Middle East. Many of us just like to give examinations, which may be a reason, and you can add to your post-nominal initials. I'm in the land of this esteemed gentleman. I don't suggest that we all take this route, but if this is your thing, then please go ahead. The sky is the limit, even in ophthalmology. However, there are disadvantages. It is not a licensing examination, unlike the FRC Oft, which Dr. Devesh will be talking to us about. And of course, it is an expensive examination, so I would strongly suggest you do financial planning as well before you embark on this. There's no point in clearing 2 parts and then finding that you're just too tired, exhausted, or busy to give the 3rd part. You would have just wasted, time, effort, and energy in that in that process. We've been on a break for this FRCS refresher course, but we plan to resume it very soon. This is conducted at Lakshmi Eye Institute in Panvel, where we have hands-on training for potential candidates for this examination with real patients. And I think these kind of courses would be useful because you need that practice of, of seeing patients and answering within that time frame to do the best during your